to work is not something that you could probably help with, unfortunately. It's internal barriers here within our hospital system because of the implementation of a new electronic health record. We got Epic last April, and it has been great in a lot of ways because we were able to make sure that our tobacco work is really sustainable within the system. You know, we were able to build in the questions that we needed and things like that. But now what I run up against is that people think, oh, we already did that. We're kind of done with tobacco. So I'm just sort of trying to plug away, find new partners, bring up maybe new, hopefully creative ways to work tobacco kind of back into the forefront a little bit. So maybe in talking this through, maybe something that could be helpful for me in this kind of meeting, or from you specifically, Jim, is just kind of creative ways that other people have been able to reinvigorate support for their programs once people think it's done.
That is a really common theme. That was a theme for BHWP. It's sort of our perpetual theme. We've been in the business for a really long time. And you know, there was a period, especially right in the late 90s, where this was really kind of exciting work. Nobody was doing it. And just sort of, that's sort of the world that we live in, is how do we convince people that we're not done yet, like after all the successes? And I don't know if I have any creative strategies, just because I think that once you, and most of the people I work with are folks like you guys that actually already get it. And then our job is to find people inside the organizations who also get it, and then they are able to find that new framing. But I think it's a great question, and I'm happy to toss it back out to the other listeners, watchers on the call. How are you able to convince people that this is still legitimate work, this is worthy work, that this is an area that still deserves a lot of attention? Nobody's got great ideas.
I think one thing, if it's a clinic or providers that serve low-income populations, to show them the data that we've made great progress, but with certain patients that are low income, this is what the data says. And if they have a behavioral health issue, this is what the data says. So we're not done yet. And I think letting providers know, or reminding them that tobacco is always changing. We have e-cigarettes now, and need to be asking about that and other forms of tobacco. There's a few ideas.
I like just to sort of take those and then generalize them. The second one's actually a perfectly good rule already. Like, tobacco is always changing. Keeping an eye on the new topics, the new trends. And then framing your trainings and your engagement around these new things. E-cigs is always, over the last couple of years, been a really hot topic for us in terms of people want us to add modules on e-cigs to the trainings we already offer. I think you guys have all seen Jamie's training that she put together 2 years ago on e-cigs, which is, if you haven't seen it, it's at the time it was really up to date, really in depth, and I'm actually going through and trying to update some of that right now, which is the only reason I know. And then to take the first comment that Jan made, looking at specific populations, and then taking that into the general rule that when you're looking to engage with other people, who do they care about in terms of both, say who or what do they care about? So there's the who, the specific populations, and then I can't think of any group of people for whom tobacco isn't an important issue, and then framing your conversation around how it impacts that group, but then also what do they care about. In the hospital systems, I know that every year, every quarter, they're always switching their priorities and trying to look at driving improvement in one or two major areas, and then figuring out how tobacco fits into those frameworks that are already being prioritized is a great strategy. Thank you, Ava. Go ahead.
This is Mickey at Northeast, and I found that if I ask, or when I'm doing my trainings, if I have my providers, I offer them practice-specific materials, and then we collaborate together to come up with new posters or brochures or intake forms or whatever they feel is going to help them with their practice. And we have started making some of our own materials with the doctor's help, and that keeps them involved.
I love
I don't
that.
know if that works for everybody, but I work with optometrists and some dental offices, a urologist, orthopedics. So we are trying to make it practice specific for them.
What does that entail? Does that include messaging and visuals, or are we just talking about getting specific practitioners' names and addresses and phone numbers onto the materials?
No, actually, I do the research, I find the materials, and they give me their ideas on what they want me to do the research and make the materials on. And we've created some posters, we've created an intake form. They don't really put their name on it, they let us put our name on it. But we collaborate together so that it's specific to them. And it can help universally with anybody else that wants it too.
I love that idea, and for at least two reasons, but maybe even more if I stopped and thought about it longer. We're always in the business of hunting down new materials, and the problem is that some of the very best materials in terms of effectiveness, and you can look at them and see how they might propel somebody to ask their practitioner about smoking cessation, or to actually have them try, is that they do tend to be extremely specific to the state or the county or the practice that generated the material. So some of the very best ones aren't really shareable in that way. They don't have that impact. So if you can get in and help people make those materials for them so that they actually just have them themselves, that's great. I love that.
I have a question on that. Have you found it to be an easy or difficult process getting those all approved by STEP? And if it has been easy, is that something that that maybe we can work with STEP to get like a whole, maybe on the Google site, everything that's been approved by them that other communities can maybe alter for their own? I'm not sure.
We haven't really had any problems getting approval on any of it. It's been practice specific with the NCHD logo on it. The intake form that we created, I'll put it out there, was if you are familiar with the shared decision-making tools that they have, they wanted just the readiness ruler on that intake form. And so we kind of simplified that for them. It's just been almost taking some of the information that we already have and putting it in a more simplified form at times. I haven't had any problems whatsoever. It's just tedious and time consuming. That's the biggest thing.
I love it. Thank you. Who is the number 303-436-6000? They're listening, but either muted or unable to hear me. So I'll just go down the list. Brittany, my Boulder County peeps, what barriers are you facing with this grant, and what do you anticipate going forward, and can I help?
I think a couple barriers. One would maybe be some tobacco specific cessation resources. I think we've got a lot of smoking cessation resources. We don't have anything specific to chew users or other types of tobacco products. So thinking about what that will look like or could look like moving forward. And I think another barrier maybe that we've been running into is just coordination of different initiatives. So looking at just a couple examples that come to mind, or maybe the JSI project and Emily's project that we learned more about a couple weeks ago. So just trying to learn more about maybe what people are doing at the state, and then thinking about how to coordinate at the local level. So that might be another barrier that is another barrier I think that we've run into.
Would it be helpful to have somebody come in and talk about that JSI grant? I mean, I feel like their meetings are open, and if people wanted to know, they could call into those, but would it be helpful for you guys if we arrange for somebody to come and talk to us a little bit, like we sort of like what we did with Emily, but actually do it as part of our official call and not on the side?
I think that would be helpful, but I also think it would be helpful to have just a list of those statewide grantees with statewide impact and cessation. So, I think often what happens is local health agency grantees work together and create, regions and communities across these specific topics. We have these learning community calls with you, but we don't necessarily get to collaborate or understand what's happening with the innovative grantees or some of those statewide grantees that do actually end up working with systems in our communities.
Right.
And so I think that's a piece of the barrier is it can be a waste of time then to try and go after a system that someone else is working on, or to not fully leverage all of the resources. We've had a tobacco program here for over 20 years and have a lot of sort of nuanced resource that I think sometimes gets missed when people come and work in our community. So I think that's definitely, it would be helpful, not just to have a single learning community, but to have a deeper, richer understanding of what's happening around cessation throughout the funding portfolio.
Sure.
I'm not sure all of the things behavioral health is doing. Are we still doing the Circles project? That's where I think it's beneficial to be able to partner.
Okay. Yeah. I will, I'll reach back out to Steph and see if they have any quick solutions, and if not, we'll do the long one.
Great. Thank you.
Yeah. And on this CHEW question, you're not the first person that's asked me about it, although the other one, the other recent one was in my other grant. And the question I always have is finding those materials and having those materials, how worthwhile to you is it? I mean, do you feel like you have the population that you'll be prioritizing those sorts of interventions? Are you going to have the population level impact that justifies taking additional time to have specialized materials, et cetera? Does that question make sense? I don't want to say like we'll throw out all the CHEW or screw them. We don't need to help them, but I mean, are you going to take the time to really to make an initiative for those particular users?
I mean, I don't necessarily know that. I think too, maybe that comment too is more just around having comprehensive resources across the board, right? So thinking about which apps do we prioritize, what are some other cessation options that are available at the state level. So thinking about it more, I mean, I think it would be nice to have specific resources for CHEW users. And obviously we have several resources for people who are smoking cigarettes, but thinking about what does that list of resources look like, and what are we recommending versus just the quit line? Or, I'm thinking about apps and websites and other types of cessation resources that exist at the state level, or I'm not sure exactly what that looks like, but just more of a comprehensive list of cessation options. When we do know that not all tobacco users are smokers.
Right.
And our resources are so smoker friendly. I don't mean smoker friendly, the company. But, even so, we've been going through the TABS report. I hope other people have too. I'm kind of afraid that the question list is going to be a Boulder moment. But, I think, even our questions are really about smokers. When we're talking about Ask Advisory for how are we assuring that people are talking about tobacco and not just cigarettes, especially when we see people switching to e-cigarettes or switching to other products. At least in Boulder County, we have a huge diversity around dual users or poly tobacco users. So I think when we look to the STEP resources that currently exist, it's really Quitline. We've built an app card. Those websites and apps haven't really been prioritized outside of our screening for things that we were looking for. But we've noticed, especially working with systems, Brittany and Meredith and Allison just had a really awesome opportunity to work on some discharge paperwork for a healthcare system. And they asked for a variety of cessation resources that don't, and discharge from a hospital system should cover all tobacco products.
Sure.
So what would we have said? I mean, I think this team did an excellent job identifying some resources, including smokefree.gov, that have more smokeless components. But as a state, as a movement, we haven't really been clear about what we mean when we say some of these cessation resources outside of the quit line.
Okay, great. Well, I'll definitely look into that. I mean, I'll look into it on the resource side. I mean, the short answer from the the therapeutic side is that the chew in particular, the smokeless products, we know that the basic NRTs work to alleviate the withdrawal effects the same way they do with smoking, but then the long-term success, long-term abstinence for smokeless users is virtually zero. And that's because what we really need to be emphasizing for them is the counseling piece. And so the resources that are going to be most effective for them are the counseling resources, whatever those are in your area. So identifying those and raising their visibility, and of course working on the stigma aspect to getting counseling and therapy, and which is of course confounded by the fact that the population that primarily uses smokeless tobacco products is also the population that eschews counseling options when they're made available. So that's really the real short, like, bad news version, if that makes sense.
Well, I think we see that play out differently for different communities that are using smokeless tobacco, right? I mean, so like I got to watch some of the ORI research with Kick the Can.
Mm-hmm.
I think that we are seeing people move to more and more online resources and groups, and and we need to be recognizing that that's a real issue, and that smokeless tobacco users need our time and attention too, especially as we see women shift into the snus movement, women and youth. The research isn't holding up for some of the new populations. So that's just something we want to think about and be mindful in our resources and referral, as well as making sure that Ask, Advise, the 2As in our model is open to different kinds of tobacco.
Good point. Okay. Well, I appreciate that, both as a barrier and as a potential thing for me to be looking into. Going down my list, Mesa County, Kelsey.
I guess one of my biggest barriers is I have a pretty set group that has been meeting, but encouraging them to kind of take another look at what they're doing in their organizations instead of just looking outside to the community and other organizations beside themselves and seeing how they can improve what other people are doing. I'm trying to steer them towards kind of some more internal insights on themselves and see what we can do with people already participating. And it's been, touch and go of the level of interest in doing that. And then a step up from that is getting them to let me help them. So I have some agreeing to do like a workflow assessment, because that's actually part of their plan, is to look at their workflow, but not getting them to have any interest in having me involved in that discussion has been another hoop for me to try and get through.
What is the specific barrier there? Is it just they don't have the time to bring you in? They just think that you're some sort of weird interloper who just wants to engage in some corporate espionage? What is the pushback?
That's a good question. With the specific organization I'm thinking about, they haven't been available to be at the meetings in person, so communications have been via email. Mm-hmm. So maybe that just timing wise, it's easy to to forget about an email. Or it's also that she was just talking about it's a struggle to, she just needs to find time for herself to do it. So it's possible that when that occurs, she may reach out, or, if I keep reminding her, but it might just be that it's not something that she's, there's not that immediacy when I offer my assistance. It's too far in the future, I guess, for her to agree for that help. I'm not sure. Still kind of working out those relationships with the different partners.
Yeah, it's always a tough game, but their priorities and your priorities are not necessarily the same thing. And I know it's advice I've given before, and I'll just keep saying it. And I know it's a lot easier to say than to follow, but trying to figure out what she is making the time for, to figure out how tobacco can tie into that. So that she's not taking on any additional responsibilities. She just has to make that 10-minute phone call with you. And if she can add a question, or if she can just add a talking point, whatever her work product is, I don't know if it's inward, if she's collecting things or she's pushing things out, just kind of getting a tiny piece of thread and tying tobacco to it. That way it's not additional heartache or hardship for her, is what I would work on. Going down my list, Kit Carson, HHS. What are your barriers so far, and what's your barriers looking back, or what do you anticipate for the coming year?
This is Erin. I guess my best answer would be just kind of lack of instruction. If we're given these scopes of work and they're pretty broad, and my site doesn't have, like Boulders has 20 years experience. I don't have any.
Okay.
I came in, pretty much not having any experience myself and no one to refer back to. That's been my big barrier this whole time, is just trying to figure out what to do with what information I get and how to best spread it out there or help people. And I've kind of made my own little things here and there, but I know it's not as productive as some of the other people. And it's really difficult kind of flying solo.
Sure.
And just getting the other resources are coming across them and thinking, oh, well, that worked for them, so maybe I could apply that. But it's been kind of a hit and miss type of thing with, not a lot of support.
Well, Erin, do you have time this week or maybe early next week where you and I can just have a chat?
Yeah.
Okay. Well, I'll send you out a. Do you have a specific day? I'll just do it now. Do you have a specific day that works for you, either Tuesday or Wednesday afternoon, maybe? Or if you want to go.
Wednesday afternoon works. Yes.
Okay, let me look at my calendar. I'll send you out a meeting request, and we'll just have a chat about what you're doing, and maybe
Okay.
do some brainstorming. If not, I'll pull out the big guns with some other folks.
Does everybody else use an internal work plan instead of the scope of work? We found the scope of work to be pretty useless in terms of telling us what to do. So we made an internal scope of work. But I'm wondering if other people use theirs or would share one. We sort of loosely built it off of some previous years that were more specific. But Brittany does a great job being much more specific and tracking it in a different way. Because we would totally agree, Erin, that scope of work is not very helpful for guidance necessarily.
No.
Jen, do share with us.
So we're currently using something called Trello. Has anybody heard of Trello before? Yeah, so we're just using it internally, basically still using the goal areas and the deliverables that have been outlined, but then Vanessa and I have worked with each of our specific goal areas and created cards, is basically what it is in Trello, that outlines the specific activities that we'll do by when. So we were able to organize it by quarter and really be a little bit more specific about what we wanted to do each quarter and how that would really look across time. So for us, it's been helpful just to track our progress and to see see where we want to go moving forward, because it was really broad too. So we've put in, how many places we plan to outreach to, or what specific groups we want to reach out to. And so it's been great to refer back to too for like quarterly reporting and that type of thing. So that's just what we've used. And I'm happy to even send over like a screenshot of what it looks like. But it's been really helpful. And you can add in notes. So like I add in notes about who we've met with and that type of thing. So it's really nice to be able to track the work too.
Gosh, that'd be great.
Yeah, I'm happy to send over a screenshot. You bet.
Brittany, is that a thing that is freely available situation, or is it a subscription service?
Trello is free.
Totally free, yeah.
I actually used it to plan my summer vacation.
And how do you spell that?
Trello. And it's a nice like project management, task management tool. But outside of that, we'll just share a list of the tasks too. I think we found, and I hope other people found, a 3 or 2 year scope of work was really daunting, right? And I was a little nervous we were going to get to like the last quarter and have that moment of like, wait, we were supposed to do what? So
I want to see the vacation planning to see if we, want to copy it, sign on. It can be our SOV, scope of vacation.
Mm-hmm. I'm going to Greece. I got to know what my hair is going to look like.
I love Greece so much. I'm going to into a weird tangent. No, but I'm going to barrel forward, get out of Athens, out of my head. Larimer, you're next, please, and Jan.
I think I'll give my thoughts, and then Jan can give hers too. I would also agree with Boulder on the whole statewide coordination effort has been a little bit of a challenge for us, and knowing what everybody's doing and how it might cross over into our specific work, especially recently, has kind of been a struggle for us. And I think another one that I'm thinking of is just trying to find those healthcare agencies who need or want our help has been a little bit difficult. There's been a few that we've reached out to, and some areas are moving, but other areas are moving a lot slower than I think what we had maybe anticipated.
And I think some of the issues are that we get really mixed messages from STEP, and even I would say from TA, and not from you specifically, Jim, but on what tools we're supposed to be using and that are approved, and how much STEP will approve alternative facts and resources. Some of us have an easy time getting that done. Some of us don't. Some of us adapt each other's tools. And it just seems like it should be clearer and more consistent and should meet our needs. Recently, we've had some good conversations with Ava and Emily, so we understand more the e-referral systems that are operating in our area. But it's just, I think that should be coordinated at the STEP level. For example, just another thing I heard from Emily McCormick is, as they were working with the UC system, that she thought that the Denver or the electronic referrals were just for ambulatory systems or providers or clinics, and that she thought there was a STEP funded internal process for referral of cessation in the UC system. And I've never heard that. And if there is, that would be something we would want to know. So it's confusing. And I think we have had really limited response from the original systems we've identified. So we've kind of made up our own work based on the gaps in our community, including getting another TTS approved person. And she's going to be doing some youth cessation services, which I think we needed in our county, and that agencies have been asking for. So we're going to be doing outreach along that. and some of our clinical system stuff bumps up against a smoke-free policy in our behavioral health system. So we provide assistance with that policy implementation and signage and communicating all these changes to other systems. So it's just, it looks different than we thought it would look. But I think we've been able to define what we need locally and kind of reach out to ask for what we need when we need it.
So on this, the scope of work being loose and not offering a lot of guidance, and the possibly mixed messages out of STEP, and the lack of any like list of specific allowed tools, I feel like maybe this grant was written specifically to provide that sort of leeway. I'm speaking out of turn on behalf of STEP here, and so I don't know that this is necessarily true. But when I read it and I see that level of authority being sort of given back to you guys, that maybe the line was pushed too far that way. I feel like what STEP wants to do is they realize that the top-down approach, the one-size-fits-all approach to tobacco cessation isn't working, and what they really wanted to do was to make sure that you guys could adapt tools so that they would fit the specific needs that you are dealing with. And so is that maybe the compromise needs to be pulled back a little bit towards some more regularization, standardization? Is that what I'm hearing?
Well, I actually probably disagree with what you just said, and sorry, and feel that they were maybe a little too specific about what we would do with agencies that we have no control over whether or not they do that. Okay. So I guess that's where I think some of our barriers come in, with saying, that we will recruit these agencies, that we will review results of their assessments and all this stuff, when really we're just having a hard time getting those agencies. And so I think they were too specific, in my opinion, of what we would do. And by we, I mean that we don't have control over that. So we have to convince the healthcare agency to do that. So I think that's kind of where I see it. I don't know if Jan agrees with that or not, but that's kind of where I see it, is that they've required us to do things that we just don't have the power to do.
Right. No, that is a known issue with this grant for sure. And that's one of the reasons why we started opening it up to the 2 calls ago, patient-centered medical neighborhood idea, to just sort of give you guys more leeway in who you partner with, because we understand that you're at their, what's the word I want? It's up to them whether or not they play along with you.
Right.
Your responsibility then is just to find those agencies and hoping, STEP is hoping that by broadening who's allowed to be a partner, you'll find more cooperative agencies that are willing to do your assessments and your evaluations and allow you to see that data. So it's, on the one hand, it's more specific in that regard, and then once you get in there, not specific enough. Is that a good reframing? I'm just trying to figure out exactly what.
No, not for me anyway. I feel like it's very specific. I think it needs to be a little bit more broad, as far as not even just who we work with, but what we do with these agencies. Like, I'm kind of looking at our work plan right now, and using the workflow, using the standardized survey tool, that's great to have. But if we wanted to work with like an agency that works with homeless, for example, that just doesn't always fit with how those agencies operate. It also specifically mentions, I can't remember how they word it in here, electronic health records. That's not applicable for a lot of the more social service kinds of agencies that we would like to work with. And the agencies that we try to work with, most of the stuff that they have here doesn't quite fit with those kinds of agencies. I feel like the work plan is very specific to healthcare agencies, and those are not always the ones that are wanting assistance, I guess.
Yeah, no, for sure, and that was specifically why two calls ago, or I guess I call them.
Yeah.
We opened outside of the healthcare agents, the primary care provider groups. Just we know that's been the issue. And so I would say that if you have an idea, something you want to work with that seems tangential to the grant at this point, especially for this next year coming up, bring that idea either to me or back to your point of contact at STEP. My guess is at this point they're going to be really lenient with their back to you on those sorts of things. We know that that's I say we like I'm on their side. I'm hired by them just like you guys are. But we've talked on our side, and we know that that's an issue, and that we're hoping to modify the terms of the grant and probably rewrite it entirely for the next cycle. Because we know
Well, as you prepare for the next RFA, I guess we would just ask that you're thinking about all of these conversations. You know, we appreciate not just a medical neighborhood, but really thinking about innovative places where we can embed cessation best practices, you know, thinking about through that location. You know, I like having a very broad contract, but I also like having a very specific internal work plan.
Yeah.
And I think that that's something that's been important for us so that we can tailor for our community. There was a lot of contractor shall language in the contract, and many of those activities were actions that we actually can't be responsible for, I think, as Lisa was just referencing. So as we prepare for the next RFA, I think that is something we would really want to think about. And then how do we support, you know, people as we also struggle with making the right connection and finding the right person and the right agency. I think we're very lucky that we have enough agencies in our community that usually someone is ready, but then how do we connect with them at the right time with the right resources? I mean, I feel like often people are like, oh, I'm surprised. I didn't know you could do that.
Right.
You know, so how do we advertise our services? What is our menu of services? And how can we be creative and innovative in that? You know, poor Brittany very much wants to work with our homeless serving community. And I've said no, because I don't feel like we have the right referrals for that yet. You know, how do we assure that we have the resources to back up our work for the next RFA cycle? I know, I think, Mike, we've talked about this a little bit in the LAC, right? And I think we still will, just how big that contract was this year.
Oh, you're still muted.
You're muted, Mike.
I unmuted you. Go ahead.
I came in late and I apologize for that, so I'm really not clear about what you're exactly talking about.
I opened this up to a complaining session.
Oh.
I'm making fun of myself. No, we're just identifying what barriers we've had going with this grant in the past, and what you anticipate for the grant going forward, and seeing if there's anything that specifically I can do to help overcome those, if I have any ideas today or perhaps later.
Okay. The only barrier that I can think of that we've had has been with getting people signed up for freedom from smoking classes. That was our goal 1 activity or deliverable. And you guys were talking about the broad scope of this contract compared to this specific deliverables, timeline, and how to measure what you've done. We still do that. We still, even though it's a much broader guidelines for everybody, we still keep our dates. In other words, this is going to get done by this date. This is going to, you know, this is how we're going to measure it. And this is the activities that we're going to do to meet this deliverable. We still do that so that something doesn't fall through the crack, or like Jen said, you know, we get to the end of the quarter or to the year or something, and uh-oh, we forgot about that or something. And I think for new people coming in, I think that, or new people that are new to this, that's something that would help them, is to give them some kind of specific guidelines to keep them on track, so that they don't get, because this is kind of a thing where it gets really busy and then it kind of slows down, and it gets really busy and kind of slows down. And so if you don't want to hit that really busy stretch and you forget something. And so that's why when we do our quarterly reports, we look at what our activities were, what the deadline times were, and what our measurement tools were.
So for those of you who are struggling with this, the broadness of the scope of work versus the specifics of actually implementing a work plan or creating an internal work plan, is that technical assistance that I can help you with? Boulder seems to, you've got your thing, but what about the rest of you? As we look at you coming up with your work plan for the final year, do you want to sit down with me for an individual and we can hammer out 12 months of deadline?
I can jump in if that's all right. I think yes. So after hearing other people's kind of comments, it's kind of come up, brought to my forefront some other barriers that I've been having, which is I'm the only one here working on this. I'm very new and I'm pretending I know what I'm doing when I'm reaching out to these organizations. So, they get interested and then I'm like, now I have to actually do what I said I knew how to do. And then just recently going through the module, I suddenly realized there was all these things that I probably was supposed to be doing that I hadn't been doing. And it's complicated for me, I think, on my end as well, coming into the middle of the 3-year grant, where it went through multiple people suddenly, and working on 2 different goals at the same time. I forget about one and will be really focused on the other for a quarter and then realize I probably didn't do anything for the one goal. And so, yes, I myself would probably benefit from having some direction on specific activities that I should aim to do during a quarter.
Sure. Okay. I think my email is open, and so and I'll send this out to everybody that if that is something that you're interested in, you let me know, and then we'll work out a time to talk. I mean, my ability and time to be able to do this is fairly open. I am dedicated to the project. I have hours of my week that are dedicated to working on this grant, so we can definitely fit everybody in, whether or not you decided to join my call today or not. But we'll reach out and do that. We're narrowing in our final 12 minutes now, so I want to make sure I hear from everybody. Mary and Scott, Pueblo.
Yeah, so the biggest thing that it seems that we're having a struggle with, and it's not really anything you could help with, is just partner engagement and keeping people engaged in what we're doing. We have reached out to different agencies. We've secured most of our partnerships for this grant, but it's just getting the new ones on board that we're struggling with, and outreach and communications and getting them to respond. So it's really not anything you can help with, but to go kind of just to give our input on the broadness of the scope of work, just to help. I think that's really good for big teams in areas that their team isn't working within this close environment. But like with Mary and I, having something like a Trello board to track is more monotonous and cumbersome than it is beneficial. So if there's only like one person who has to, creating your own internal work plan might be more work and do more like busyness than what it's worth in the end. And that's just my opinion, but I just wanted to share that out there because there are only 2 of us here and we work pretty fine without having to do all that extra stuff. So
and we tried the Trello board at one point and it just didn't get utilized with our small group.
And there's always a trade-off. You guys, does everybody read the XKCD computer script or the comic strip online? If you don't, he has a recurring gag where he's a programmer and a mathematician by trade, and he always has the graph of how much front loading is involved in programming for something. You want a program routine task. You don't have to think about them very much. But I apply it to project management. Sometimes some people are just addicted. They want to put their Greece vacations into a program management software, for example. And I'm the same way. I just like to make these constant lists, checklists, and I'll open up MS Project, and then sometimes you realize that the project that you're planning is maybe just a little too easy to do. Maybe you didn't need to bother making all the to-do lists for it. So yeah, there's always trade-offs. We can definitely, and those of you who are interested in talking to me about shorter term goals, and what those would look like for this particular grant. We'll discuss what those trade-offs look like too. I think I've heard from every team. Teddy, I haven't heard from you though. Did you want to chime in with any additional comments? You might be muted if you're talking, Teddy.
Your house is so beautiful.
You're like, we're not that kind of game.
Well, my yard's like pristine.
Yeah.
You know,
Go back to muting him. Okay. All right, everybody. So we have 9 minutes left. This was awesome. I thought I was going to take notes on Post-it notes, but then I ended up taking 7 Post-it notes worth of notes. So this is really productive for me. Is there anything I can give to you in our final few minutes here? Any questions that I might be able to answer off the top of my head, or emails I can promise, phone calls?
I don't know about off the top of your head, but I really am interested in knowing how people are sitting with the TABS data, especially around cessation. Is that something people have had a chance to look at yet or think about? I know, we're not getting regional data, but that was something that had been really helpful for us previously, was looking at our ask, advise, refer percentages. And I'm wondering if other people have had a chance to look, or any thoughts at sort of the report as it sits right now, and maybe other information we'd want to ask for.
I'll leave that open for you guys, not me. I have not had a chance to take a look at it yet.
I've looked at it, but I don't have any, I guess I just want to wait and see how the call goes, and then.
Others?
I haven't had a chance to look at it yet either.
I looked at it, but it was a little bit ago, so I don't, off the top of my head, remember anything specific. I'd never looked at it before, so it was like the first time really seeing what's on there. So that was helpful for me to just get some perspective on what is gathered.
Jen, did you have any specific concerns or things that struck you in the TABS report, since you've spent some time with it?
Well, I feel dumber, I think, after reading it a little bit, in that it was pretty hard for me to understand a lot of the report. But, I think there were some interesting pieces about how people are quitting. And actually, I pulled the 2012 questionnaire because the 2015, it wasn't posted yet. But there were some insights in the questions that I actually think would be really interesting for us maybe to ask for a different data poll, or talk with Michelle about a little differently. Like, some of the questions actually get into really deep, how are people quitting? What are barriers to quitting? What are reasons they might not quit? That I actually would love to see a statewide poll on those, and they weren't in the report. But there were some interesting things in the report in terms of who's quitting and who's not, and how people are quitting, how much refer has jumped. This report did not say it, but I think there's a congratulations in order.
I can't wait to look at it now. Maybe I'll invite Michelle to join us for our next call. Maybe she can bring somebody over from the CPEG team that can talk to us about it. That way, maybe we have some, and then so if between now and then, because we have plenty of time, if everybody can take a look at it, that will be great. I'll put a reminder and a link to it in the in my follow-up.
Jim, are you going to be on the? There's a TABS update call this week, right?
Wednesday.
That is not on my calendar, so maybe I should.
I mean, I think it was in the newsletter. I'm just kidding. That's my favorite answer when tell me something and I am like, what? Newsletter.
I'm sure that I can find it. TABS meeting.
So Wednesday, so the state is doing an update, and they had asked for questions in an Excel sheet. And then I hope we can do follow-up questions, because I want to see what they what they're offering. But it would be great to have additional, maybe cessation specific follow-up after that. But just letting you know there is a overarching call this week.
Thank you very much. All right. Anything else? Closing points, questions, comments? All right. Thank you guys. This was awesome for me. Hopefully it was awesome for you. And I will apparently hear some of you on the TABS call later this week. No. And if not, we'll see each other soon.